Good day. I'm Dr. Santhosh George Thomas, one of the neurosurgeons at Macquarie Neurosurgery. I have a special interest in neuro-oncology dealing with brain and spinal cord tumors. At Macquarie, we believe in a team-based approach to achieve the best outcome for our patients. We have a team comprising of neurosurgeons, neuroradiologists, radiation and medical oncologists who make collective decisions for patients with complex brain and spinal cord tumors. This is an illustrative case of a patient with an intraventricular tumor. So the tumor is located in the ventricles of the brain, which are hollow spaces that generate and contain cerebrospinal fluid. This fluid encases the brain and the spinal cord, providing cushioning and protection. It is produced by the choroid plexus, which is a complex network of capillaries lined by specialized cells. Now, most intraventricular tumors are benign and grow slowly inside the ventricles. They're often discovered by chance or become noticeable when they kind of block the cerebrospinal fluid pathways leading to hydrocephalus. The primary clinical symptoms generally include headache, hydrocephalus, and visual field deficits. Additionally, cognitive issues such as patients with attention and memory can also occur. So this is the preoperative axial MRI of the patient with contrast. There you can see a tumor located here, this white homogeneous structure which is in the ventricle. That is, this structure is called the lateral ventricle, and this is the atrium of the ventricle where the tumor is located. So you can see how large the tumor is. This was about 6.5 centimeters in size, displacing the structures around and in the atrium of the ventricle. The trick is to get the shortest trajectory to the tumor and then approach it without damaging any of the critical structures and aim for a gross total resection. This patient presented with minimal headache and a visual field deficit. Now, he could not see in one half of the visual field in both eyes. This is called a homonymous hemianopia and usually happens when the optic radiation fibers get damaged by the tumor. Though these are benign tumors, the sheer size can make it very challenging to treat, and if it continues to grow, it can become life-threatening. These tumors are at a depth in the brain, and they're generally quite vascular and bloody, making their removal quite challenging. The primary treatment is to aim for a gross total resection, which means removal of the tumor completely, and that's usually curative in nature, of course, depending on the grade of the tumor. Now, in this patient, we were able to successfully map the shortest trajectory to the tumor here from the surface of the brain, taking care to preserve the normal structures along the trajectory. Then you get into the ventricle, the vascular feeders are carefully cauterized and detached from the attachments, and then we progressively debulk the tumor slowly, and it's slowly removed with very minimal damage to the adjacent structures. This patient made an excellent recovery and was discharged home in about a week. All patients with tumors need progressive surveillance, the frequency depending on the histopathology of the tumor, and so you need surveillance scans even after the operation. This is the postoperative scan of the patient showing a complete excision of a very large tumor located in the ventricle of the brain. This is an illustrative case, and the results cannot be translated to all patients. The treatment strategy varies according to the patient and their specific condition. Please talk to your medical practitioner for advice. Thank you.